Upper West Regional Hospital suffers setback. The Upper West Regional Referral Hospital in Wa has been operating at suboptimal capacity following a number of challenges facing the facility, including inadequate capital to purchase consumables. There is also lack of medical professionals such as doctors and nurses, including vehicles, accommodation and the inability of the National Health Insurance Scheme (NHIS) to reimburse the facility. The medical director of the hospital, Dr. Robert Amesia, was speaking to the Daily Graphic in an interview in Wa last Wednesday. The hospital began functioning on January 9, 2020. The $52 million hospital with state-of-the-art facilities was inaugurated on August 18, 2019 by President Nana Addo Dankwa Akufo-Addo, and later handed over to the Ghana Health Service after testing and commissioning of equipment. Challenges. Dr. Amesia said the hospital had not been provided with any seed capital to serve as a revolving fund. As such, management was finding it difficult to procure basic and essential consumables such as gloves, especially during emergencies. Right from the word go, we had to begin with struggles, which was a bit frustrating. This is a facility where you cannot operate without the requisite investments. We are now operating at our wits' end since no assistance is coming from anywhere, he said. Dr. Amesia also said, the hospital had only one rickety vehicle for administrative purposes and said there was also inadequate staff bungalows for critical staff such as medical officers, nurses and other paramedics. The situation got worse when the hospital was selected as a regional center for the treatment of COVID-19 cases, he added. The director also said, for the past 8 months, the NHIS had not reimbursed the hospital for its claims, thus bringing its IGF under stress. He said the hospital had only 20 bungalows even though it needed at least 50 medical officers, 350 nurses, junior staff and other staff for its 17 units to be able to operate efficiently. Electricity. Dr. Amesia further said electricity was another major challenge confronting the facility. At the moment, he said the hospital was connected to the Nadoli-Humley power grid, which was congested and frequently went off, compelling them to spend at least 3,000 Ghana cedis fuel to power their generator. Attempts to get the facility hooked onto the national electrification grid at Sawa was proving difficult, because the hospital cannot afford the 1 million Ghana cedis being demanded by the Northern Electricity Development Company, NEDCO, Dr. Amesia said. He, therefore, called for the immediate intervention of the Ministry of Health and other stakeholders to help address the challenges to facilitate efficient healthcare delivery in the region. Response. When contacted, the Upper West Regional Director of Health Services, Dr. Damian Punguyira, said he was collaborating with the NHIS to settle the claims. On the provision of seed capital, he said the Ghana Health Service was working towards addressing some of the challenges faced by the hospital. He said the biggest challenge of his outfit was the failure of critical staff to accept postings to the region due to limited opportunities, such as educational facilities for their children and accommodation, among others. Dr. Punguyira said some of the measures they were considering included the rollout of attractive incentive packages to motivate and attract staff to the area. He expressed gratitude to the Regional Coordinating Council (RCC) for its support, which included the allocation of bungalows to the Health Directorate to meet its staffing needs. Near Ghana, Accra.